This will be a recorded lecture on remote learning for the ankle musculature. So the first one we're going to look at is going to be the gastrocnemius. Its main job is going to be plantar flexion of the ankle, but it also aids in flexion of the knee. When we're looking at the origin of the gastrocnemius, we can see that there's a medial and a lateral head for the origin, and these are going to be located on the posterior surfaces of both of the condyles of the femur. And then we can see it inserts, both the medial and the lateral head of the gastrocnemius are going to insert on the posterior surface of the calcaneus. When we're looking at the tibialis anterior, again, its primary function is going to be dorsiflexion of the ankle, but it also aids in inversion of the foot. The anterior tibialis also supports the medial longitudinal arch. Its origin, as we can see here, is going to be the upper 2/3 of the lateral surface of the tibia. And then the insertion, it's very small, but the insertion will be the medial cuneiform, or the base of the first metatarsal bones. The extensor digitorum, when you're looking at the name, these are going to extend the digits, so the lesser of the four toes. And then we also see it involved in dorsiflexion of the ankle and also eversion of the foot. The origin is going to be the lateral condyle of the tibia, and also a little bit further down, basically in this region, we're going to see it, the head of the fibula and the upper 2/3 surface of the anterior surface of the fibula. So we see the origin not only in the tibia, but also in two components of the fibula. And then the insertion would be the lesser, or top of the middle, and the distal phalanges of the lesser four toes. Peroneus longus, also sometimes referred to as fibularis longus, its main jobs are going to be eversion of the foot and also aid in plantar flexion of the foot. The peroneus longus also helps bind the transverse arch, especially during any type of contraction. So as this muscle contracts, it helps support the transverse arch. So the origin is very broad. It's not only the head and 2/3 lateral surface of the fibula, and then the insertion is actually going to wrap underneath the foot, and it's on the undersurface of the medial cuneiform and the first metatarsal bone. And finally, the peroneus brevis, or sometimes referred to as the fibularis brevis, its main actions are going to be eversion of the foot, plantar, and aids in plantar flexion of the ankle. The peroneus brevis also aids in maintaining the lateral longitudinal arch of the foot as it depresses, so during weight bearing. The origin is going to be the 2/3 surfaces of the lateral surface of the fibula, and then the insertion is going to be the tuberosity of the fifth metatarsal bone. So it's the extension here on the outside of the foot.